Hello guys, welcome and welcome back to my YouTube channel. If you're new here, kindly consider clicking that subscription button, and if you are a returning subscriber, thank you very much for always clicking in. Don't forget to share, don't forget to like, don't forget to comment, and the most important, don't forget to turn on your notification bell so that every time I upload a video you will be the first person to be notified. So welcome back again. Right now, or today, or in this video, I want to talk about female genital mutilation, or FGM, the common name FGM. So the reason why the government is against FGM, or the whole world is against FGM, is because it doesn't have health benefit to a young or women who usually practice this female genital mutilation. So in this specific video, I will talk about types of FGM and complications that may set in when you are a culprit of a female genital mutilation. So let's get into the video. So female genital mutilation comprises all the procedures that involve partial or total removal of external female genitalia or other injuries to female genitalia or organ for non-medical reasons. Yeah, for non-medical reason. Did you get that? Total or partial removal of female genital organs or genital organs or external genital organs for non-medical reasons. Yeah, so the practice has no health benefit. As I have said when I was starting this video, the practice has no benefits to girls and women and causes severe bleeding and problems with the urinating, and later you can develop cysts or you can develop infections, and as well complications in childbirth, and increase the risk of newborn death. Yeah, so the practice of FGM is recognized internationally as a violation of human rights of girls and women, because girls and women are the most people who are affected. To make the matter worse, in this era, there are some community who hide under the ground and still practice female genital mutilation, which is not good, and you are violating human right, especially the right of a woman and those small girls you are exposing to so many complications that might set in. So let me say, it reflects deep-rooted inequality between the sex and the constituents, an extreme form of discrimination of girls and women. Yeah, it is nearly always carried out by traditional practitioner on minor and is a violation of human and child right. So, if you are practicing FGM, just know the World Health Organization strongly urge healthcare providers not to perform even female genital mutilation. And remember, these healthcare providers are people who are professional, and if this FGM had health benefits to ladies or women or girls, the government or the people who are responsible for human rights and everything would have come up with strategy and would have strongly recommend FGM. Yeah, so if you're practicing FGM, just know you are violating human rights, you are violating the rights of these girls and these women who doesn't know or who doesn't have any idea what is going on. So the next thing that I'm going to talk about is specifically types of FGM. We have 4 major types of FGM. Yeah, because when I was starting this video, I said FGM is total or partial removal of external genitalia of women and girls, or damaging of external genitalia for no medical purposes. So we have some types of FGM that you have to know. This community who are still practicing FGM, some of them usually practice these types of FGM, and even they are not aware which type of FGM they are practicing. So type 1, this is the partial or total removal of clitoral organ. Yeah, this is the total or partial removal of the clitoral gland or organ. So if you are practicing, if you are in that community who usually remove the clitoral gland, and you know the clitoris is the sensitive organ and it is very important during sexual intercourse, because they usually have some notion that if they remove this clitoris, the women will not be exposed to sexual desire when they're still young. So that is why I think they're trying, or they usually remove this clitoris or clitoral gland so that these girls do not have desire for sex. And this community usually get that most of them, women don't have right to say no or yes to sex. Yeah, and I wonder the reason why they are exposing these ladies or this girl to this painful procedure. And in fact, this community, you will get that they usually practice early marriages. They usually practice these early marriages. I don't know the reason why they usually remove this thing to reduce the desire for sex for ladies, and still they practice early marriages. I don't know the reason. I don't know. Maybe if they tell us. And just remember, when you have been caught doing this FGM, just know you are in a hot soup. Let's go to type 2. Type 2, this is a partial or total removal of clitoris or clitoral gland and the labia minora with or without removal of labia majora. So they can, in external female genital, we usually have parts of external genital, of female genital, external female genital organs. We have parts. We have the minora, the majora, the clitoris, the prepuce, the vagina, those glands. We have so many. Maybe I will put a picture so that you can see what I'm talking about. If I talk about the labia majora, labia minora, so you know what I'm talking about. So this type 2 is partial or total removal of clitoral gland and labia minora with or without removing the majora or the labia majora. The majora and minora, those are the folds that usually close the vulva. I will put the picture so that you see what I'm talking about. Type 3, also known as infibulation. Yeah, it is also known as infibulation, and this is the narrowing of the vaginal opening. Okay. I can't imagine. This is the narrowing of vaginal opening through the creation of a covering seal. So the seal is formed by cutting and repositioning the labia minora and the labia majora, and sometimes through stitching with or without removal of the clitoral gland or the prepuce. Yeah, I will put the picture so that when I'm talking about this thing, you know what I'm talking about. So imagine this type 3, you are reducing the vaginal opening. Remember, when this girl will start menstruation, you can imagine the pain this woman will face. And remember, this community practice early marriages. Sometimes these girls usually get married when even their reproductive organ is not fully developed. And remember also, in this type 3, they have stitched or they have narrowed the vaginal opening. How will this mother give birth? Or how will this woman give birth? And these are the community where mortality and motility, for maternal mortality and motility, will never go away in those community. Type 4, these include all the harmful procedure to the female genital for non-medical procedures, e.g. they can be pricked. Remember, someone is just pricking your genital organs, and that place usually are that place is usually very sensitive. They can prick the organs, the external organs. They can pierce, they can scrap, they can catheterize the area. These are just harmful procedure that they are doing to the external female genitalia. Surely, kindly, those community who are practicing this female FGM, I would want, or I would wish you stop, because even you don't have the clear reasons of doing it. So, as we have said, female genital or FGM has no health benefit, and it harms the girls and the women in many ways. It involves removing and damaging healthy and normal female genital tissues, and it interferes with the natural functioning of the girls and the women's body. When God was creating a woman, God was not a fool to put that female that external genitalia there. God has so many reasons why He put the external genitalia in female. So these people who are interfering with the creation of God, I think you will have an answer when you will be asked the reason why you are doing whatever you are doing. So we have some of the complications that will set in. That is why I told you the government and the whole world is against this female genital mutilation. The first complication is severe pain. Okay, this complication I will divide them into two: the immediate complication and the long-term complication, the immediate complication and the long-term complications. So I'm saying that we have the first complication is severe pain. If someone is pricking your genital organ, someone is suturing the genital organ, obviously you will have pain that can make you go even into shock. We have seen those people who perform even male circumcision without the traditional one, how they perform the traditional one. People usually die. Someone can have pain until this person goes into shock. Yeah. So pain, severe pain is one of them. Excessive bleeding that can also cause shock is also another complication. We have genital swelling. The area will be swollen, and somebody can have fevers. Infection like tetanus can set in. Urinary problem. This person will have problem with urinating. We have wound healing process because the procedure is not even clean, it is not aseptic. They reuse this equipment, so wound healing problem is another complication. Injury to the surrounding tissues, that is a common one. And I said bleeding and pain can cause death and can cause shock. Those are immediate complications that if you're practicing, if you're still practicing FGM in your community, you are not updated, you are in old age stage, you are just a primitive person who doesn't know what is taking place around the world, who still doesn't know what are the complications that might set in when you perform those procedures. Now, let's go to long-term complications. Number one, we said we have urinary problem. And this person may have painful urination throughout their life. This person may have urinary tract infection for most of the time in their life. So, urinary problem is one of the long-term complications. Another one, problem with the vagina. There will a discharge. There can be an unhealthy discharge from the vagina, itching, bacterial infection, and so many complications that may set in to this woman. We can have a menstrual problem. Remember, there was a type where it involved reducing the size of the size of the vagina. Now, this time, if this community practice the specific type, that type 3, this woman will suffer a lot of menstrual problem, difficulty in passing menstrual blood, painful menstruation, a lot of problem related to menstruation. And we can have keloids and tissues. Have you ever seen someone who has been burned by a water or something, and then they form those big scars? This is the same thing that can take place to external to that genitalia of a woman that has been done for female genital mutilation. This person can have keloids. This person can have scar tissue that are not healthy. Another one, they can have a sexual problem. Remember, they are reducing the size of the vagina. This person will experience pain during sexual intercourse. This person will have decreased satisfaction during sex. These are women who never get satisfied when they have sex because they removed the sensitive part that play an important role during sexual intercourse. Another problem that will set is increased risk of childbirth complication, where most of the time these people will have difficulty with delivery. Remember, they stitch the vaginal opening. This person can have obstructed labor. This person can have how do you call it, perineal tear, a very serious perineal tear during childbirth that can complicate to fistula, and these people can be at risk of going for cesarean section. Cesarean section is a major surgical procedure, a major surgery, which can also bring other complications, and maybe this person might have newborn death because of obstructed labor. And remember, these people, this kind of people, they are people who don't usually go to deliver in the hospital. And then, now the next point. The next point and the last one is psychological problem. Depression can set in, anxiety, post-traumatic stress, low self-esteem, and other procedures and other disorders that cannot be treated. So those are the things I wanted to say about FGM, because it is not healthy, it is not right, it is a violation of human right, it is a total mess of female genitals organ. So if you are a community that practice this procedure, kindly I will request that you stop it, because it has no health benefit. If those our ancestors practiced this procedure, you are not in those days where the procedure was practiced for reasons that were not even valid. Right now the world is advanced, and you should be updated. You should just get updated even without being told. So I think I will stop there. And if you have not subscribed, kindly, I don't know what you are waiting for, kindly subscribe, like the video, share, comment, and the most important, don't forget to turn your notification bell, so that every time I post a video, you will be the first person to be notified. So bye till next time, let's meet in the next video.